Hi class, let's finish up our discussion of diseases of the nervous system with botulism. Botulism is caused by an exotoxin, just like tetanus is. The causative agent of botulism is Clostridium botulinum. It's going to be associated primarily with eating very poorly preserved foods. More so than Clostridium tetani, Clostridium botulinum is known for contaminated food that's been poorly canned or poorly preserved at home. We occasionally can incur botulism if there's an actual true infection, but many times just consuming the exotoxin that's been building up in the contaminated food is enough to incur this illness. Until recently, it was relatively common and very frequently fatal. Thankfully, modern methods of food preservation have dramatically reduced its incidence, and medical treatments have improved and decreased the fatality rates. As a general rule of thumb, for those of you who like to preserve your food, if you see bubbles or any kind of gases forming in the food that you're canning or preserving, just throw it out. Don't eat it. There's probably some kind of microbial growth, and you do not want to chance it. Some of the signs and symptoms of botulism poisoning include weakness of muscles. Depending on how the disease got into the body, maybe it's foodborne, infant, or wound-based botulism, there's going to be a different population affected, and the symptoms manifest themselves differently. Generally speaking, though, muscle weakness or the inability to contract the muscles is the key symptom of botulism poisoning. This botulinum toxin is going to travel to the site of action where the neuromuscular junction is between the skeletal muscles, or at the skeletal muscles between the motor neuron and the skeletal muscle, and it's going to cause acetylcholine to not be released. And if we cannot exositize acetylcholine from our synaptic vesicles, then we can't use that neurotransmitter to initiate muscle contraction. Usually, after inoculation with this pathogen, it takes between 12 and 72 hours for the symptoms to onset, depending on the size of the dose of the toxin or endospores. Early symptoms of botulism poisoning include double vision, some difficulty swallowing, dizziness. Generally speaking, these are going to be symptoms that are going to be associated with mild muscle weakness. However, our sensory abilities and mental abilities are not going to lapse. Later on, as the disease is progressing, there's going to be descending muscular paralysis. And as that muscular paralysis descends to the thoracic cavity, we're going to have eventually the diaphragm unable to contract anymore. And once the diaphragm is no longer able to contract, patients will die from respiratory arrest. Now, you can take the patient and put them in an iron lung or mechanical respirator and breathe for them. Those mechanical respirators can reduce the fatality rates to as low as 10% if there's full-fledged botulism poisoning. As I mentioned a couple times before, the causative agent of botulism poisoning is Clostridium botulinum. This is an anaerobic bacterium that is capable of forming endospores, and it's going to do damage by releasing that botulism toxin as an exotoxin, so it secretes the toxin actively. This Clostridium botulinum bacterium is going to be present in the soil and water, occasionally in the intestinal tract of animals, so it's fairly ubiquitous, just like Clostridium tetani is. It's occurring worldwide, but most often it's going to occur within the northern hemisphere, which just coincidentally is also where most of the people and most of the land masses are in the world. So I think it's more a coincidence than anything else. The species of botulinum, Clostridium botulinum, has several different serotypes or subtypes that vary in their distribution among animals and the kind of world geography that they're inhabiting, and the kinds of exotoxins that they're secretion. There are different subtypes or serotypes of Clostridium botulinum. If we look at our Clostridium botulinum subtypes, A, B, E, and F subtypes are typically associated with the disease state within the human beings, and A, B, C, D, and E subtypes are associated with the disease state within the animals. Clostridium tetani, which I talked about in our last presentation, is going to release tetanospasm, which results in spastic paralysis and contractions. And then Clostridium botulism releases the botulinum toxin, which results in flaccid paralysis, or the inability to contract your skeletal muscles. Here we can see the motor end plate, or the neuromuscular junction, I should say. And within that neuromuscular junction, in a healthy functioning adult, there will be acetylcholine being released via exocytosis to trigger contraction on the opposite muscle. But if we expose that synapse to botulism toxin, that botulism toxin prevents the exocytosis of the acetylcholine-containing vesicles, and we cannot trigger muscle contraction on the adjacent muscle cell. Our diagnostic standards for the 3 different kinds of botulism are going to vary depending on what kind we're working with. Very minute amounts of the toxins are incredibly dangerous and lethal. And laboratory testing should be done by very experienced personnel that know how to appropriately handle the toxin. A suspected case of botulism poisoning, generally speaking, is going to initiate a series of events. There's going to be a phone call to a state health department and or the Center for Disease Control to register the incident and proceed with the diagnosis and treatment to seek some advice. The Center for Disease Control maintains a supply of type A, B, and E trivalent horse antitoxin. This can be administered early on and can prevent the worst outcomes of the disease. If a patient is managed with respiratory and cardiac support systems, they can continue to breathe and have their heart pumped even if they have the spastic paralysis of their respiratory tracts. Generally speaking, hospitalization is going to be required no matter what. The recovery is going to take weeks, and even with treatment, there is a 5% mortality rate. So, to summarize, botulism is caused by the organism Clostridium botulism. The virulence factor is the botulism exotoxin, and treatment involves antitoxins and antibiotics. So, concept check class. If a patient injects food that is contaminated with C. botulism, what would one of the first symptoms be? I think this is probably the hardest concept check question I've given so far this semester. And I say that because I did not directly spell out the answer in your text, in your presentation, or in the textbook. So, I'll work you through it right now, as opposed to telling you to look up the answer. If a patient injects food that's contaminated with C. botulinum, that food is going to have a lot of the botulism toxin in it. That botulism toxin is going to immediately start to diffuse into the surrounding tissues that are surrounding the digestive tract. And that toxin is going to cause all the muscles that it comes in contact with to become flaccid. As the muscles of the gastrointestinal tract become flaccid, we lose peristaltic motion throughout the intestines, and there will be a lack of bowel movements associated with having food-borne botulism. So if a patient eats some contaminated food and doesn't go to the bathroom for a day or two, that's a defecate for a day or two, that's a very good indication that they have botulism poisoning of the food-borne variety. Here's a figure summarizing all the diseases of the nervous system. If you have any questions about this presentation, please feel free to post them on the discussion board or shoot me an email. Happy studies!